Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Causes of iron deficiency. Iron deficiency can occur either due to the increased demand of the iron. So, one iron deficiency can occur due to increased demand of iron and hematopoiesis, or it can be due to increased iron loss, or it can be due to decreased iron intake on absorption. So, increased demand of iron and hematopoiesis is seen in rapid growth in infancy and adolescent. In order to produce large amount of RBCs, we require more iron. Then in pregnancy, obviously the mother has to provide the iron to the baby also, so there is increased demand of iron. In erythropoietin therapy, there is increased demand of iron, because if you give erythropoietin therapy, you are stimulating blood production, so iron requirement is also more. Then it is also increased in iron loss. In iron loss conditions like acute or chronic blood loss, in menstruation, or in hookworm infestation, the iron deficiency anemia is seen because of iron loss. Then there is decreased intake of absorption. Decreased iron intake or absorption is seen in whenever there is less diet. When you take less iron in the diet, obviously there will be decreased absorption. Or if the patient is suffering from sprue or cilia or Crohn's disease or post gastrectomy states, even then the iron absorption is decreased.
thank you and thank you for watching.